All right, so it's going to be a bit of a different meeting, only because we have a bunch of things going on, great things to talk about and to do this morning, including welcome our food pantry representatives this morning so we can present a donation to them. And we're going to hear a little bit about what's happening in the food pantries here during the business portion of the meeting. We're going to get an update on how things are going in terms of a brief update on how things are going in terms of getting ready for the big summer concert series. And then we have a full-fledged speaker this morning who's going to be connecting in here in the next 10 minutes or so from ProHealth. And Rachel's going to have an introduction for her. We're going to hear about a topic that's on all of our minds in terms of how are things going in terms of the pandemic, vaccines, how ProHealth is helping in that regard. So I want to welcome the guests. We have Cindy Eggleston and Carol Hall with her husband Tom here from McGuanago Food Pantry, as well as the kitchen cupboard. And we're going to have Vicki Dallmann-Papke here in a little bit later. So welcome this morning. We'll hear from you in just a bit. We can't go a week without hearing profound thoughts. So let's, Dr. Herligson, you have a few. Bring it up, and then we'll
probably could. Morning. My first thought is from H. Jackson Brown. He said, "Our character is in what we do when we think no one is looking." I think this is Women's History Month, so I looked for some quotes from women. This one's from Margaret Thatcher. "If you want something said, ask a man. If you want something done, ask a woman."
Oh,
She was definitely opinionated. This last one's from George Carlin. It's a little hard to follow, but he said, people who say they don't care what people think are usually desperate to have people think they don't care what people think.
Jackson Brown said it's got to be somebody's baby. So anyway, all right. So we're gonna save the Rotary Minute for next week, but we got to do happy finds and drawing. And as part of that, John Wydell from the village and from our club is going to give us an update on how things are going. So why don't you lead it off, John?
Sure. Yeah. So I have. Where's the happy find?
I'm the happy find.
And I owe for a pin, so I'm just going to dump what I got. Anyway, the inspector and the public works director and I went to the high school yesterday and met with Dustin to take a look at the stage, and they had two of them built and put together, they look very cool. We only had some minor modifications. They'll be building those over the next several weeks, ordering the rest of the lumber. I think the Rotary's pledged about $6,000, so half of that will be the materials. The second half is we have to have all that material fire sprayed because stages need to be fire resistant, and that'll be taking place with Public Works. I don't know if anyone's been to the Rotary Facebook page recently, but promotional materials for the concert series is out. There's 4 of them. June 11th, July 9th, I don't know, they're up there, and then September 11th. So please go to the Rotary page, the village's Facebook page. Tickets are free, the parking is free. So I don't know, does anyone have any questions for me quickly? Otherwise, things are on target and in progress.
All right.
Okay, thank you.
A lot of happenings this summer, outdoor happenings in McGuanago, including the usual Maxwell Street Days, Balloon Fest, 4 summer concert series, and just to fill a few gaps for some of the folks who aren't as aware of the effort going on, high school vocational service, building trades. Kids are building a temporary stage. The permanent stage is in the works. It's gonna happen, but it's not gonna be ready for this summer. So we are funding a temporary stage that can be used for the 4 shows. And it's currently, as John said, being built at the high school and working that. So one of the things that we're doing for that effort this summer. Of course, we have Balloon Fest also that the chamber is organizing. So things keep getting better, weather-wise, health-wise, everything else. We can have a lot of goings on here in Mukwonago. Last week, about a dozen or so of us went to the high school, saw the robotics club and demonstration from them. Very impressive group of students, and we had made a financial donation to their competitions and their expenses as well. So happy to support them. Okay, more happy finds and drawings. Don't want to get past that. Anything else?
Happy finds? If you don't, I'll ask one of our guests. Carol, could you just reach in there? Oops, excuse me. I meant to say Cindy. That's read the last 3 digits.
008.
008. You have that?
I don't think that's me.
Make sure I got it right. Yes.
008.
All right.
All right.
Well. All right. We'll see Greg on the way out. All right. Great. Let's see, our guest speaker is on. Vicki, nice to have you here this morning. We're going to do some food pantry donations and hear from them a little bit, and then we'll get to hear your message this morning. So appreciate you being here. So in terms of just a brief business items, like I said, it's going to be a busy summer. We're currently organizing our committees, volunteers, the schedules, because we are going to be part, besides sponsoring it, we also are going to be a vendor. In fact, Jerry and I are scheduled to be on a vendor meeting tomorrow morning to hear some guidance from the village and how that's going to go and convey some of our needs and that. So that's going along. I am currently in the midst of putting together next year's Rotary leadership for the club. I've had some opportunities for some folks to step up and join the board and such. So I'm going to be reaching out and putting out the message that if somebody would like to get a little more involved in the club and become a member of the board, there are at least a few positions that are potentially open for next year. Other than president, I get to do that again. In fact, I have pets this weekend, starting tonight through Saturday, virtually online, so I'm not in Chicago. But in terms of board members, I'm going to be reaching out to some folks. But anybody who hears this, who has interest in joining the board or coming back to the board, please let me know, and we'll go on that. All right, so let's get to one of the important parts of our meeting today, and that's to both hear from our food pantry representatives, as well as, of course, provide a donation to their cause in the important work that they've been doing for a long time, but especially this past year or so. So, Cindy, you mentioned to me you have one of your colleagues that's on the Zoom call here, Hannah. And Hannah, are you just going to provide us an few minutes of update on things that are going on?
Yes, I am. If you're ready for me to speak, I'll launch right into it.
Yeah, go ahead.
Okay, fantastic. So what I'm here to specifically talk about is the Dairy Recovery Program. So for those of you who don't know, the Hunger Task Force, using CARES Act funds, was able to buy about $1 million worth of Wisconsin dairy products from dairy farmers and cheese producers. So those funds were provided through the CARES Act, and then the Hunger Task Force then worked with all of us partner agencies to distribute that milk and cheese. So the Mukwonago Food Pantry has served as a distribution hub because of our connection with the Hunger Task Force to 7 area smaller food pantries. So essentially we would get a pallet of milk and a pallet of cheese, which is about 1,000 pounds of cheese and about 216 gallons of milk. And then we would break that up between ourselves and smaller food pantries in the area so that we could all have a share of that milk and cheese, and not any one would be stuck with 216 gallons of milk. It's a lot of milk to put in fridges. So that was something that we have been working on since last May. It began in last May, so it's been almost a year. And to date, so far, we have distributed over 5,000 gallons of milk, and we've distributed over 24,000 pounds of cheese. And, you know, being able to partner with those 7 local area pantries have also created a really great synergy in terms of sharing other resources besides the milk and cheese. When one of us had an excess of a different commodity, you know, say New Berlin had extra pasta they wanted to get rid of, or Eagle had extra cereal, we were able to swap and trade things, and it worked out really well. Particularly, we ended up with an excess of sanitation buckets from the Home Depot that they put together for us. So we were able to give those out to the area food pantries as well. So that has worked out really great. And those partnering pantries are Sussex, Muskego, New Berlin, Eagle, Kitchen Cupboard, and Vivint Health, which has a food pantry that serves specifically people with immunocompromised or immunosuppressed populations. So we just wanted to make sure you guys were aware of this wonderful program. It's been wildly popular, and we are happy to have that funding that has been super helpful through that CARES Act. And then just thank you again to the Rotary for keeping the Mukwonago Food Pantry in your fundraising efforts. So, thank you.
All right, great. Thanks for that update. Well, you're welcome. And that's what you know, we're here to talk about this morning. Is a few months ago, one of our Rotarians, Mark Blodgett, was aware of a fundraising opportunity that was being done elsewhere in the greater Milwaukee area. Put together a team to have the drive-through beer garden, coordinated with East Troy Brewery. We sold almost 100 boxes with the idea and with the message that the proceeds would support the local food pantries. People are aware of the current need. Happy to say that it was a successful event, and I have checks here, and you can come up here in just a minute. I have checks here for $1,500 for both the Mukwonago Food Pantry and the Kitchen Cupboard. So we like to think ourselves as people of action. So it provided us a great opportunity to get together and do a fundraiser and do it for a good cause. So Carol and Cindy, if you can come forward. And let's get a photo. John, could you take a picture with my phone? My phone. Well, your phone, and I will send it to you. Okay. All right. So, on behalf of the Rotary Club, it's our honor to present to both of you checks that you can put to good use. Let's get the photo.
Ready. 1, 2, 3. Smile.
Okay. All right.
Thank you.
Yeah, and as we as a society continue to work through these times, we are making the transition over to talking about the pandemic and the vaccine. It's obviously been a very strange time in that we have quite a bifurcation in society in terms of those like myself who have jobs that continue on through this, and then of course there are many out there who have service jobs and others who are struggling significantly during this time and don't have the employment or the level of employment they need to keep things going, making Hunger Task Force, the food pantries, that much more important. So ladies and Tom, you're welcome to stay and hear our message from ProHealth, or you're not going to offend us if you have things to do, but you're absolutely welcome to sit and listen to the rest. I just want you to feel trapped though. But I'm going to introduce Rachel, who is going to introduce our speaker this morning.
Thank you.
Morning, Vicki.
Good morning.
Thanks for joining us. I'm just going to do a brief introduction. So, Vicki Dallmann-Papke is our Vice President of Population Health Management. So, huge scope that she has. She's over our employee health, quality department service line leader of orthopedics. So I'll talk about that a little bit, why that's important. During COVID, Vicki quickly operationalized the process in collaboration with employee health, our IT department, so that includes like our telehealth and our ProHealth care medical group to provide COVID testing for employees and our patients. And why that's really important is especially at our peak time when our hospitals were full, our clinics were full, that was able to get our employees tested as quickly as possible so they could be taking care of our patients. She's really worked closely with the county and state. There is a COVID task force. So the data that you're seeing, you know, in the news and things, that's really coming from Vicki's team. Over the holiday, over Christmas, we had gotten, and you can correct me, Vicki, if I'm wrong, but I think it was like Christmas, New Year's, her and her staff were working all hours to get our employees vaccinated. The staff that were on the front lines on the COVID units, they were all vaccinated within a week or two. So kudos to that. She leads the COVID vaccination committee to ensure successful operations of vaccination and future planning. So she'll talk a little bit more about that. Waukesha County has really led the percentage of population of patients being vaccinated, and also the state of Wisconsin. So that's really important. I think we really take it for granted. I talked to my cousin the other day. He lives in Colorado. They have no vaccination, so he had to drive to Wyoming. So, I mean, I don't think we realize how fortunate we are. And then other operations, Vicki leads our orthopedic service line, and she really works closely with all the operations. So surgery, PACU, day surgery, inpatient, the surgeons. And that's important because for a while, as you all remember, we had to put some surgeries, unless it was emergent, kind of on pause, or we had to cap, and we were able to get up to 100% capacity really quickly. So you think of all those other patients that are in pain and they really need their surgeries. And so I think she did an excellent job. So I think we're really fortunate to have leaders like Vicki, because she led this team to get our patients safe and keeping us in a safe environment and to really move forward. So without further ado, I introduce Vicki. Thank you.
All right.
All right, thank you, Rachel. I hope everybody can hear me okay. As Rachel alluded, we're very fortunate in Waukesha County. We have about 408,000 residents in Waukesha County, and right now we're nearing 25% of those folks being vaccinated. A great deal of those are our healthcare workers, but the vast majority are those over the age of 65. Nearly 60% of the vaccine recipients have received the vaccine that are over the age of 65. So I'll talk a little bit about ProHealth Care and how ProHealth Care has moved through this very, I believe, seamlessly, but it's taken a village. We started on 12/23. The vaccine arrived on that day. We had 1,170 doses, and we got that out immediately to our frontline workers, and then started to move very judiciously through our priority groups. We are now at the priority group of over 65, and now moving into teachers. So I'll talk a little bit about our experience and how we chose to vaccinate and where we vaccinate. We vaccinate at Waukesha Memorial. We have a large area that we can accommodate between 700 and 900 people in a day. Our day starts at 9 and ends at 4. For our teachers, we'll be having special hours because they have working hours, and our seniors can come from 9 to 4, but our teachers can't. They need to come before or after work. I will talk about that service at Waukesha Memorial, and it's unique that we knew that we were going to be seeing folks in the dead of winter that were over the age of 65. So we needed a place that had valet parking. So we arranged for valet parking, undercover parking. We needed facilities to escort individuals in. And we needed our volunteers as well as our vaccinators, our registration, and an observation area. If you've received your vaccine or heard in the media, you really have to stick around for 15 minutes post the vaccine. You never know what vaccine we're going to get, so we have to pivot very quickly on if that individual is coming back in 3 weeks or 4 weeks, or now with the Johnson & Johnson product, not have to come back at all. As we move through that, our demand is very high, but our supply is limited. So we ask for patience all day long. So how did we do it at ProHealth Care so that we made the largest impact? My background is in population health management, and making sure that the frailest folks got the vaccine first was our first priority. We used an algorithm that was put together by Mayo Clinic, that our Epic partner, which is our EHR, our record, electronic record, where we store all of our information about our patients. We stratified our patients based on their risk. It was a score that included their comorbidities, age, etc. We invited the very highest risk individuals in first. And as we went through the categories, we are now at medium and low risk folks, but we feel very proud that we vaccinated the extremely highest risk people first instead of just opening up to all 65-year-olds. That really helped our county, I believe, reduce mortality because of the fact that the 70 and 80-year-olds, when they get sick and have comorbidities, it's not usually a very good outcome. They get hospitalized for a very long time. So I think as our team worked through how best to do it, I think it was the best decision how we move forward. I know that didn't make a lot of folks happy that were 65 and were very healthy and wanted to travel, but we had to explain to them we need to have the very frailest people go first because they're our most vulnerable and they are potentially could succumb to COVID. So as we move through that, we've vaccinated in the county, like I said, over 60% of the folks over the age of 65 have been vaccinated. We still have work to do. There's still folks out there. We're still inviting them in to be seen. But we've moved on to teachers. We work very closely with the county on all the school districts, including the private schools. And we divvied up the school districts based on what we could handle. We gave a list of school districts we could work with. 2 of them were given to us, which are Waukesha School District, 1,600 employees, St. John's Northwestern Academy, about 85 employees. We start their vaccines on Tuesday, and we will very quickly go through that vaccination process between 7 a.m. and 9 a.m. in the morning, and then throughout the day. They're very happy to get those vaccines through us, and I think it will go really super quick. We'll receive the Johnson & Johnson vaccine, which is the latest on the market. It's a one-shot, very effective. We should not be afraid to take this vaccine. It's very efficacious. It actually produced no hospitalizations or no deaths during their trials. That's 100%. That's a good vaccine. So if you can get a vaccine, whether it's Pfizer or Moderna or J&J, take whatever you can get. They're all 3 very, very good vaccines. Wanted to talk a little bit about the entire process with us. We've worked very closely with our process improvement department, and we have decreased our length of stay, quote unquote, in the clinic to 1/2 hour. So it's a few minutes to get registered, a few minutes to get your vaccine. The most time you spend with us is in the observation deck. I call it the deck because we have to make it fun here. We don't serve cookies and coffee, but we have a little fun with it. And observe our individuals, and then they're free to go right after. So we've had very positive experience with our vaccination process. Again, the demand is very high, and there's a lot of synergy around that, but our supply is limited. But as supply picks up, you've probably heard Evers in the media saying he's very close to opening it up beyond teachers and essential workers now. We will be moving into very quickly, not sure what the date is, with those with comorbidities, which is over 2 million people in the state of Wisconsin, which will keep us going for quite some time. So we're very fortunate in Wisconsin. We're number 18. We were number 5 for a while, but we've dropped down to number 18. But we're making very good progress in getting our vaccine out as quickly as it arrives. So that's our program. I'm very passionate about it. We work every day on this. We meet frequently. The next step is to work with our inpatient managers on vaccinating our inpatients as they're discharged, our home health or homebound patients, as well as those that are seeing our medical group for an appointment. So as the supply gets more plentiful around the Johnson & Johnson product, it's a little easier to handle. 1 dose, they don't have to come back. We will have those opportunities for our ProHealth Care folks as they use our services. So I'll take questions from folks if they have questions about the vaccination or vaccination process or our approach to how we're moving through the various priority groups. So just, yeah.
Vicki, I have a question. So I work with the Mukwonago Food Pantry. We have the Mukwonago Food Pantry Resource Center. Would there be any possibility of eventually getting to a place where we could serve as a vaccination hub where people could sign up to get one of those shots? Do you think that that kind of satellite locations will be something that'll happen in the future?
So you have to be a vaccination site. You have to register with the state of Wisconsin. There's a lot of education. You have to have freezer. So the sub-sites don't kind of work because of that aspect. And I will let you know we've had no waste with vaccine. So you have to be very time conscious as well as have the demand there. So at this moment, I don't think the products that we have would be likely that will happen. The mass sites probably are the best because of parking, et cetera, et cetera. So, but more to come as we kind of go through this journey. You know, I would be open to it, but right now with the presentations that we've had, not conducive at this moment.
Thank you.
Sure.
I have a question. At present, when you go for a vaccination, you get the vaccination or the manufacturer that they happen to have at that particular point in time.
That's correct.
Is how soon will it come that we can decide if you have a preference for one of the manufacturers? Will we be able to find out who's dispensing which vaccination and to be able to go and make our appointments there?
Yeah, I think it's going to be a while yet, but you always can, you know, during your appointment here. And we've had folks that say, I don't want Pfizer, I don't want Moderna, I don't want J&J. And we give them the information on each product. And they can delay and locate, or most people will take what we have. But I think it'll probably be closer to summertime where there'll be plentiful vaccine and you'll be able to choose. But folks are going to be limited to what they can handle. Walgreens most likely will not have Pfizer. They'll have Moderna because of the freezer capacity. Not all the Walgreens have freezers. And J&J product can be refrigerated. So it really depends on the location you're going and what the capabilities are. And for a health system, we have those very deep freezers. So we get Pfizer, but we have received Moderna. And now we receive J&J. So we kind of don't know what we're going to get week to week either. So we can't even inform our patients week to week which vaccine we get until it gets here.
Thank you, because I have a question. We are hearing that in the population as a whole, and I don't know the age group breakdown, that there is 25-30% of the population that is hesitant or not interested in getting the vaccine. You say we're at, thankfully, 55-60% of above 65. Are you starting to see that you're getting to the point where perhaps the demand is going to start waning off with regards to that? And I mean, we'd love to get 95% of above 65. But chances are there's not 95% of the population above 65 who wants the vaccine. So are we seeing that yet at all?
I don't see vaccine hesitancy in over 65. In fact, they take the most flu shots. They're herd immunity in flu shots. So I think we'll get way over 70 to 80% in this population. The next population, the school teachers, we're seeing minimal vaccine hesitancy. They're calling like crazy. I think once we get down to the groups that are just the general groups, those with no comorbidities, that's going to be the hardest, I think. We'll see. We'll see. I might be surprised. If you get a vaccine and they say you can travel, I bet you get a vaccine. So then the hesitancy goes away. So will we get herd immunity? I'm very optimistic in Waukesha County. We will get herd immunity in Waukesha County. I'm very optimistic about that.
Can you provide some perspective? I mean, those of us that watch the news hear national numbers. Like back in December, we were hoping to get to 1 million injections a day. Now it's 2.5 to 3 million. Politics aside, just in terms of what's been able to be done from a Waukesha standpoint or Wisconsin standpoint, is it just that there has been more doses than you were being told back in December are going to be available? What's what's leading to this good news that we're doing 2.5 to 3 million a day nationally versus like the 1 million maybe, which maybe they were under promising.
Yeah, I think they were under promising, and now there's more supply, and people have their systems in place so we can get it out quicker. So we only have 5 business days when it arrives on Monday to get it out. If we do not get it out, we are penalized. So we have, and we won't get vaccine the next week. So we are challenged to get the vaccine out as soon as we have it. So as soon as it's here, it's out, it's gone. And I think everybody across the country understands that and have gotten their processes really quick. And that's why you saw the ramping up of 1.5. You actually saw a $2.5 million, 2.5 person vaccine in one day. I think that was a couple Saturdays ago. So it's coming. I think the supply is there and people's processes are very, very quick and understand what needs to be accomplished.
So April, May or so, the healthy 30-year-old who's willing to get the vaccine, perhaps by May or so, that man or woman could potentially get it. But it seems like we're on a path for that.
Yeah, I mean, they keep changing. The last I heard was end of April. They'd be plentiful supply to supply everyone, every adult. So I think, we're counting by June 30th. That's when my funding runs out and I have to go back to Susan Edwards. By June 30th, I said we would have everybody that is attributed to ProHealth or wanted the vaccine. And if we had enough supply, we would be done. And then we would just vaccinate those people that hadn't gotten the vaccine and start planning for the booster. We have to plan for a booster. We have to plan for influenza for the fall. So my team just keeps rolling with this. So we'll go right into influenza planning and then right into COVID booster planning. So.
Great. Charlie, you have a question?
Well, now I've got 2 questions.
All right.
When you stated that Waukesha County, 60% of 65 and older, of which I'm a member of that, is vaccinated. Now, obviously, ProHealth is vaccinating. I live in Waukesha County, but I got my first vaccine in Milwaukee County at a Walgreens. So did my wife.
Mm-hmm.
So 60% of 65 and older in Waukesha County, is that from, do you guys know, or does somebody know, everybody, regardless of where they got their shot, if they got it at Aurora, if they got it at Walgreens, if they got it at Meyer Pharmacy, did they accumulate it just based on when we sign up, we got to fill out all this paperwork about address? Is that where they accumulate that data?
Yeah, it's required that all vaccinators put their vaccine information in the Wisconsin Immunization Registry. So that includes your address, so that vaccine received in Milwaukee County counts at Waukesha County. So we're glad you got it in Milwaukee County, but it counts for our numbers in Waukesha County. That check, you're done.
Okay, good. And my second question goes to your booster question. A lot of people I talk to are saying, is there going to be a required booster shot? And if so, is it going to depend on which vaccine you took? And how long is that going to last? And is there a variant? It's going to be like flu, whatever.
Yeah.
Because they adjusted. You mentioned you're planning for a booster, but is there any sort of determination yet about how quick you need a booster and for which vaccine you need it? Because I haven't heard anything about that.
Yeah, too early to tell. A lot of chatter around that. All those questions are being considered. We'll see what happens, but we are planning for a booster. I went through a pandemic already once. We planned for that booster and we gave that booster with the influenza. If you remember H1N1, it was another difficult year we had in the United States, not so bad in Wisconsin, but we planned for that. So we will plan for whatever the federal government sends us, and we will do. So we have to plan, but don't know what the product is, don't know how it will present. Will it be in an influenza vaccine or will it be separate? So we'll just have to take that when it comes, but we're planning on holding mass clinics for boosters.
Another question? Yep, your time.
One more question, and this may or may not be in your sphere. International travel. Have you heard anything about other countries requiring proof of vaccination for entry. I know right now, I have a Danube River cruise. I'm supposed to fly to Budapest. And right now, Hungary is really not accepting tourists, number one. And if you do get in, you got to be quarantined 10 days. And the cruise is only 7 days long.
Yeah, you know, there's a lot of rules around travel. We know that domestic travel is not an issue, but international travel, if you're traveling, many are saying you have to have a COVID test or positive test within 3 days. They're not considering vaccination at this point. That is what I've heard. Many of our colleagues that have traveled, and then when they come back, we ask them to monitor their symptoms, etc. But there's more to come on that. I believe there will keep your card, you know, handy with you, and that'll change as some of the rules get loosened up. As we heard this past week, you know, if you've had the vaccine, you can do a couple things, but we can't put ourselves at risk quite yet, taking masks off or social distancing or hand washing, but you might be able to hug your grandchildren and be in a household that's completely vaccinated and have a small dinner party. That's about the extent of what the CDC is saying, but we keep an eye on international travel and domestic travel here because I have a travel clinic as well, and I have those questions being asked of us constantly. And we just say, you know, just continue to monitor the country you're going to and follow the rules of what they say for that week, which might be a COVID test 3 days before, and quarantine, and then when you come back, what you need to do to come back. So,
Any questions from our members online? Anybody who's on the Zoom call have a question? All right. Anybody else here in the room? Yeah, I mean, I watch the numbers daily from the DHS here in the state, and like to see when they're down around 300 or 400 and no deaths. And you know, some days things get you know, a little bit higher, but it's much better than the 8,000 or so that we had back in November. I would think with 50, 60, getting close to 65, 70% of above 65, we should hopefully see a lot less hospitalizations and a lot less deaths going forward in terms of cases. Hopefully that goes down as well. But you know, it's like anything, it's a matter of risk in terms of hugging your grandchild when you're vaccinated and things like that. I tell my kids, you know, imagine if they were putting out guidance in terms of driving to work and all the safety, and that you could get in an accident, but chances are you're not. But wear your seatbelt and, you know, take all the precautions you can. You know, life is a matter of risk. But thanks for your message this morning. Any final questions? But thanks for all you're doing, and the folks at ProHealth and everybody else, frontline workers, making this happen and helping us hopefully get on the other side. As we talked about, we got lots of great things coming up, not only in our individual lives, but this summer with events and such. We don't want to see cancellations or changes to those. We want to go forward as we can. So appreciate you taking the time this morning, Vicki, and giving us the message. I will say, I'll give this to Rachel. We do this for all our speakers. Rotary is very familiar with vaccinations. Since the mid-1980s, Rotary has been at the forefront of vaccinating for polio around the world, and not quite eradicating polio yet globally, but getting very, very close, and have been very close. So in gratitude for your message that you shared with us, we're going to be donating funds to Rotary International for 25 children in the world to be inoculated against polio in your honor, given what you do every day, the appropriate symbolization there. So thanks so much. I failed to mention that we have another guest here this morning, who's C4, works with Rachel as an intern.
She's in graduate school, Carly.
Carly, so great to have you here this morning, Carly. All right, anything else anybody like to bring up? Otherwise, we will end the meeting with our four-way test as we leave this meeting and go back out to the world of life and work. You can stand, please. Of the things that we think, say, and do, let's remember to ask ourselves first, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? Fourth, will it be beneficial to all concerned? All right. Got through that. Thanks. Thanks, Hannah, for being on this morning. Thanks, everybody. Everybody online. Dennis, have a good time in Florida. I'm not sure if you're still on, but